Hello friends, let us now learn some important points about the acute fluid collections in pancreatitis. So one of the local complication of pancreatitis is acute fluid collections. So acute fluid collections means that whenever the patient has pancreatitis, then there can be fluid collections might be seen at least around the pancreas or around the pancreas or around any other organs. So almost 40% of patients with acute pancreatitis will develop this acute fluid collections. And among these who develop acute fluid collections, 70% will resolve because they will have non-necrotic pancreatitis. Because they have non-necrotizing pancreatitis, the acute fluid collections in almost 70% of them will resolve. Then, so we do not need to do any drainage or anything for this acute fluid collections because 70% of them will resolve. So no drainage or no doing any surgical intervention or nothing is required for these patients with acute fluid collections. Unless if a super infection occurs. Rarely if any super infection occurs, then we there whenever there is any super infection occurs rarely, then drainage might be required or any surgical intervention might be required, or else in 70% of the cases it resolves on its own with non-necrotizing pancreatitis. Then we have a classification called as Atlanta classification. According to this Atlanta classification, it says that in order to differentiate between the acute fluid collections with pseudocyst, because acute fluid collections or pseudocyst, in both these we have fluid collection only. But when should we call a fluid collection as acute fluid collection or pseudocyst? For this, it has made a deadline of 4 weeks. So in order to differentiate, we have to take the consideration of 4 weeks from onset of disease. So if the uh, fluid collection is less than 4 weeks from onset of disease, then we call it as acute fluid collection. If it is more than 4 weeks from onset of disease, then we can call it as pseudocyst. Okay, but in most of the cases, in other different doctors or other scientists suggested that instead of taking 4 weeks, it is better to take 6 weeks definition. So whenever there is fluid collection after 6 weeks, then we call it as pseudocyst. And pseudocyst might require 6 weeks to mature, and these pseudocysts are required to be drainaged. So pseudocysts are also fluid collection which are seen in the pancreas, and these should be drained surgically. So if you see, we have acute fluid collections. Most of them will resolve, but in some conditions drainage may be required. Atlanta classification says that 4 weeks. If it is less than 4 weeks, then we can call it acute fluid collection. If the fluid collection is seen after 4 weeks, then we can call it pseudocyst. But others have given the definition to be more than 6 weeks. Now, in the picture, this is the picture which is showing the acute fluid collection. This is the stomach. Here we have pancreas, and this is the acute fluid collection which is seen in transverse mesocolon. Then if you see, this is the picture which is showing acute fluid here, and there is inflammation here, and similarly there is an acute fluid which is noted here, which is seen here. So these are the pictures which shows acute fluid collection. Thank you.